Ja, jeg har hjertestans her på Värmlandet.
Du har hjertestans der, ja.
Jeg har pustet, men jeg er helt vekke.
Ja, det var en helt vanlig dag i september. Det var fine vær ute, så Karl Arthur han var ute i hagen og arbeidet. Jeg hadde søkt permisjon fra jobben, så jeg satt i staua og arbeidet med et album. Og så kommer han inn og skal ha seg en pause fra arbeidet og sette seg i lenestolen. Og vi småprater sikkert litt, og så plutselig så dette høyest bakover sånn. Og så hører jeg en sånn merkelig lyd, merkelig pustelyd. Og da springer jeg til med en gang og slår han i ansiktet og prøver å få kontakt, og så var ikke der noe liv, noe kontakt. Og så tok jeg da trådløse telefonen og slo 113, og den ringte, og jeg husker at jeg følte det som en evighet, de 2 ringesignaler før at de tok telefonen.
Karl Arthur, jeg må ha ned på gulvet. Nå stopper hjertet hans.
Puster han nå?
Nei, jeg stopper hjertet hans.
Kan du ligge han på gulvet?
Nei, jeg ligger på stolen.
Kan du få han ned på gulvet?
Ja. Karl Arthur.
Og Karl Arthur er jo stor og tung, men jeg fikk han ned på gulvet og begynte med en gang med hjertekompresjonene. Og det var litt godt å ha den telefonen, fordi at den hadde høyttaler på. Så jeg satte den på, sånn at jeg kunne snakke med henne. Etter hvert så jeg drev med hjertelungeredning. Du er flink, sa hun. Du er veldig flink, og jeg skal prøve å skaffe hjelp så fort som mulig. Nå må jeg gjøre rett, sånn at jeg klarer å holde ut lengst mulig. Ta et fast tak, og så må du legge hendene mellom brystvortene, strake armer, og så bruke kroppen og vippe frem og tilbake. Og så prøve å komme inn i en god rytme.
Ja, og har seg en hel jobb da, Rutta.
Ja,
for det være helt alene, og så klare å organisere at det kommer noen.
Ja.
Det var godt gjort da.
Ja, det var litt hektisk, ja. Og for hjem at det er helt ubeskrivelig. Det er helt utenkelig. For han lå jo død her på gulvet. Og så har jeg han med meg hjem til bilen 3 uker etterpå. Så det var fantastisk. Det er helt, der finnes det ikke ord for det, tror jeg. Men det var en glede som vi fikk lov å begynne på det på nytt. Så det var deilig.
Do you ever wonder what happens when you dial 113, medical emergency response? Do you know what kind of help you will get? My name is Ingrid, and I will be your instructor today. As your instructor, I will teach you how to best help someone who is in cardiac arrest. To allow us to practice, you will also see me as a nurse answering the emergency response call. Emergency response, how can I help you? 113's mission is to provide advice on first aid and to send an ambulance when necessary. Today, you will learn the most important steps in CPR: to recognize cardiac arrest, call 113 to get help, and to give chest compressions. Sudden cardiac arrest occurs most often in the home, where family or friends are the closest who can help. Cardiac arrest is a serious condition. No one will survive without treatment. When the ambulance comes, they will perform CPR, administer medications, and maybe defibrillate the patient. This may save some lives, but if good CPR is performed before the ambulance arrives, the chance of survival more than doubles. Therefore, everyone should be able to perform CPR. In this course, I have an assistant instructor named Henrik. He will help us practice. CPR is easy to do with the help of a dispatcher. Do not be afraid to make mistakes. In fact, the only thing you can do wrong is to do nothing at all. First, I will show you what this course contains. The mannequin should be on its back in front of you. We suspect something is wrong and crouch down beside the patient's face.
Annie, can you hear me?
First, we try to wake Annie. If we are unable to wake Annie, we will call 113 for help.
Yes, my speaker is on now.
Good. Place the phone in front of you so that we can hear each other. Do not hang up. We sit on our knees with one knee on each side of the arm. We check to see if Annie is breathing normally. If it is simple to remove clothes from the chest, please do this now. If Annie can't be woken up and is not breathing normally, we begin chest compressions. 1, 2, 3, 4, 5, 6,
7, 8, 9, 10.
You're probably wondering why we are not doing mouth-to-mouth. In the first minutes after cardiac arrest, chest compressions without mouth-to-mouth are effective treatment. Therefore, you will learn only chest compressions today.
4, 5, 6.
But we would like to see you again in the next course to repeat what you have learned today and learn how you can become an even better lifesaver. It's normal to be surprised when you see it happening. The fact that someone you know collapses in front of you, or you suddenly suspect that there is something wrong. Most people do not recognize the signs of cardiac arrest. Many believe that someone in cardiac arrest does not move at all. A person in cardiac arrest is unconscious and cannot wake up. Skin color may be pale or bluish. But most importantly, the person does not breathe normally. Breathing may be perceived as strange and abnormal for several minutes after the heart has stopped. Some take a deep breath, gasping, almost like a fish on land, while others just lie very still without any kind of breathing. Therefore, it may be difficult to see if someone is experiencing cardiac arrest. We only need one rule. If you are unable to wake the person, call 113 and we will handle it together from there. So, first, I try to wake her. If the heart is stopped, I will not be able to wake her. Then I call 113, emergency response number. Watch me now. I shake her gently by the shoulders while I shout, "Hey, Annie! Can you hear me?" I cannot wake her, so she is not asleep. I need to call 113 and get help.
Emergency response. How can I help you?
It's my aunt. I can't wake her.
What happened?
I don't know, but I can't wake her.
Where is the patient? What is the address?
We are at Main Street number 10 in Oslo.
Okay. Put your phone on speaker and tell me when you are done.
Okay. I have turned the speaker on now.
Okay.
Did you notice that the emergency responder told me what I should do, and I replied that I understood the message and confirmed when the action was performed? This is a good way to communicate when you can't see each other. Everyone should now sit on the floor with the mannequin in front of you. Now you will practice with my assistant, Henrik. You find your aunt on the floor. You suspect that something is wrong and call 113. Ready to try from the beginning? Let's start.
Annie! Annie! Can you hear me?
Emergency response. How can I help you?
It's my aunt. I can't wake her.
What happened?
I don't know. It looks serious, and I can't wake her.
Where is the patient? What is the address?
We're at home. Main Street 10, Oslo.
Okay, we'll help you. Do you know how to put your phone on speaker?
Yes.
Okay, put your phone on speaker and tell me when you are done.
Okay. Yes, I have you on the speaker.
Good. Put your phone on the floor in front of you.
Okay, the phone is now on the floor.
Good. Now we have established good contact with emergency response. You are ready to perform CPR and speak with the operator at the same time. In the next chapters, we will practice CPR with help from emergency response. The first thing to do is find out if this is cardiac arrest. Do this with help from the emergency responder. Do you hear normal breathing sounds? The primary symptoms of cardiac arrest are the patient will not wake up and is not breathing normally. Quite a few patients may breathe abnormally for several minutes, even if in cardiac arrest. So that you are comfortable and can easily access both the chest and face, I recommend that you sit in this way. Place her arms straight out from her body and put your knees close to her body with one knee on each side of the arm. Watch now how I check to see if she is breathing normally. I then put one hand on her forehead and tilt her head back while I lift her chin with my other hand. I hold her head in this position. The airway is now open and I can see and hear if she is breathing normally. I look to see if the chest is rising normally. I listen for normal breathing sounds. I use 5 to 10 seconds to find out if she is breathing normally. I see no chest movement, hear no breathing sounds, so she is not breathing normally. Now you will check to see if your patient is breathing normally together with Henrik. Ready? Start. Place the patient's arms straight out from the body and sit on your knees close to the patient with one knee on each side of the arm.
Okay, now I'm sitting with one knee on each side of the arm.
Place one hand on the forehead of the patient and bend their head back while lifting the chin with your other hand. Bend down with your ear close to their mouth and look down to check for chest movements and listen for normal breathing sounds. Do you see the chest rising in a normal way?
No.
Do you hear normal breathing sounds?
No. She's not breathing normally.
If the patient can't be woken up and is not breathing normally, you must start chest compressions. Good quality chest compressions are the best help you can give a patient in sudden cardiac arrest.
5, 6, 7.
When the heart
8,
stops beating,
9,
it
10,
stops pumping
11,
oxygen-rich
12,
blood through the
13,
body and up to the
14,
brain.
15, 16, 17,
Effective chest
18,
compressions
19,
can replace
20,
the pumping
21,
action.
22, 23,
It is
24,
therefore
25,
important that you do
26,
chest
27,
compressions
28,
until the ambulance
29,
arrives.
30.
Here is some important information about chest compressions. You must press the lower half of the sternum between the nipples. You have to press quickly. You have to press hard, at least 5 centimeters. You have to release completely between each compression. To learn to press hard, the mannequin has a help function. The mannequin clicks when you press hard. You should press at least as hard as this. Clearly, a real patient does not click when you do chest compressions. But it is normal to hear sounds from the chest during chest compressions. It is important that you continue to press hard and fast, even if you hear sounds. These sounds are not dangerous. Now, look at me. I've put myself in a good position to do chest compressions. I put my mannequin's arms straight out from the body and sit on my knees close to her side, with one knee on each side of the arm. So now I have to find where on the chest to do chest compressions. I remove any clothing that is easy and quick to remove. Doing this makes it easy for me to find the compression point. I find the point midway between the nipples and the lower portion of the sternum and put one hand on top of the other. I sit up so that my shoulders are directly over my hands. With straight elbows, I press down firmly and release all the way up again, like this. Did you hear the click? Now you will do chest compressions together with Henrik. Place Annie's arms straight out from her body and sit on your knees close by her side with one knee on each side of the arm.
Yes, I'm sitting with one knee on each side of her arm.
If it is easy to remove clothing from the chest, do it now.
Yes, I unzipped her jacket.
Find the point midway between the nipples on the lower half of the sternum and place one hand on top of the other. Sit up so that your shoulders are directly over your hands. Push hard and deep at a fast pace. Count out loud with me. 1, 2, 3, 4, 5, 6.
7,
Good.
8.
Continue
9,
at this pace.
10,
11, 12, 13, 14.
15.
Are
16,
you releasing completely
17,
between
18,
each compression?
19. Yes. 25.
Are your arms straight?
Yes.
Good. Count out loud with me again. 1, 2, 3, 4, 5, 6, 7,
8.
Are you pressing
9,
midway
10.
between the nipples?
Yes.
Great. This is going well. Count out loud with me again. 1, 2, 3, 4, 5.
6, 7, 8, 9.
Good.
10.
Continue like
11,
this.
12.
13, 14, 15, 16, 17, 18, 19, 20, 21.
22, 23, 24, 25, 26, 27, 28.
Count out loud with me again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19.
20, 21, 22, 23, 24, 25, 26, 27.
That was
28,
good.
29,
You can now
30.
stop. Now you know how to perform chest compressions. Let's put everything we've learned together. Before we begin, you need to get your mannequin ready. Pull up the zipper and put both arms by the body like this. Ready? This time we will practice together. I'll talk you through it, and you do the same thing as me. Now let's start. You find Annie on the floor. You suspect that something is wrong. Annie! Can you hear me? You can't wake her, so you call 113.
Emergency response, how can I help you?
The emergency responder now asks what has happened and where the patient is. This is necessary to send help to the right place. In order to do CPR while you talk to the emergency responder, you should put the phone on speaker function. Put the phone on speaker function by pressing the speaker icon. Put your phone on the floor in front of you. Do not hang up. Place Annie's arm straight out from the body and sit on your knees close by her side, with one knee on each side of the arm. Are you sitting like me now? Check if the patient is breathing normally. Place one hand on the forehead and bend the head back while lifting the chin with your other hand. Are you holding the head like me? Now that the airways are open, we can see and hear if she is breathing normally. Place your ear close to her mouth and look down the chest to see if it is rising and falling. And listen for normal breathing sounds. I saw no chest movement. I heard no sounds. She is not breathing normally. Therefore, we should perform chest compressions. Open Annie's jacket. Put one hand on top of the other midway between the nipples. Lean forward so that your shoulders are directly over your hands. Are you sitting like this now? With straight arms, push hard and fast. 1, 2, 3, 4, 5. Be sure to release completely between each chest compression. Press midway between the nipples. Remember to press hard. Good. This is going well. Do you hear the click? Are you pushing as fast as me? Continue like this. Proceed as follows. Release completely between each chest compression. 1, 2, 3, 4, 5, 6. Press midway between the nipples. This is going well. Remember to push hard. Keep your arms straight. Use your body weight. Do you hear the click? Are you compressing as quickly as I am? Keep going, a little more. Now you can stop. It may take 10 minutes before the ambulance arrives. We know that people who have learned CPR are able to provide good chest compressions for at least 10 minutes. That's why it is important to master the technique of performing chest compressions. In a cardiac arrest situation, it is normal that the patient does not start breathing until the ambulance arrives. The patient may have abnormal breathing and gasping while you are performing chest compressions. But as long as the patient is not breathing normally, it is important that you continue to give chest compressions until the ambulance personnel arrive and take over. This time, we will practice without the mannequin clicking. Pull out the tab under the chest. Like this. The mannequin will not click when you do good chest compressions. In this chapter, Henrik will do CPR while you will see me as the emergency telephone responder. Henrik finds Annie on the floor. He suspects something is wrong and tries to wake her. Annie does not wake up and he calls 113. I am on duty today, so you will see me in the corner of the screen when the conversation starts. This time we will do everything in quick succession just like it happens in real life. You will do the same as Henrik. Try to remember what you have learned. Now we will start from the beginning. Are you ready?
What happened here? Annie, can you hear me? I can't wake her. I need to phone 113.
Medical emergency response. How can I help you?
It's my aunt. I can't wake her.
What happened?
I don't know. It looks serious, and I can't wake her.
Where are you? What is your address?
We were at home, at Main Street 10 in Oslo.
How old is the patient?
She is 50.
I will help you. I am sending an ambulance. I see that you are calling from a mobile telephone. Turn on the hands-free speaker and tell me when you are ready.
Okay. The speaker is now on.
Good. Put the phone on the floor in front of you so we can hear each other. Do not hang up.
No, I won't hang up.
Lay her on her back. Place her arm out to the side away from her body and sit close to her with one knee on each side of her arm.
Okay, she is on her back. I'm sitting with one knee on each side of her arm.
Put one hand on her forehead and bend her head backward while you lift her chin with your other hand.
Okay.
Bend down and put your ear close to her mouth. Look down at her chest. Is it rising and falling? Can you hear normal breathing sounds?
No, she's not breathing normally.
Then you must begin chest compressions. I will help you. The ambulance is on its way. Listen to me. If it is easy to remove her clothes from her chest, do it now.
I have unzipped her jacket.
Find the midpoint between her nipples on the lower half of her sternum and put her hands there on top of each other. Have you done this?
Yes.
Push down hard, deep, and quickly. Count out loud with me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
11, 12, 13,
Good.
14,
Continue at this
15,
pace.
16, 17, 18,
Very good.
19,
Are you pushing
20,
with straight
21,
arms?
22, yes.
Are you releasing the rib cage completely between each compression?
Yes.
Are you still in the middle of her chest between the nipples?
Yes.
Are you compressing hard?
Yes, I'm pushing hard.
Are you using your body weight when you compress?
Yes.
Good. Count again with me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
11,
Good.
12,
Continue
13,
like this.
14,
The ambulance
15.
is on the way.
It looks like Annie is trying to breathe.
That's a good sign, but you need to continue doing compressions. Count again with me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
11,
Good.
12,
Continue like
13,
this.
14,
Are you still in the
15,
middle of her chest
16.
between the nipples?
Yes. 19.
Are you
20,
compressing
21.
hard?
Yes, I'm pushing hard. 23, 24, 25, 26, 27, 28, 29.
You can
30.
stop now that the ambulance has arrived. The ambulance personnel will take over. We have done compressions without stopping the entire time. We have worked together. It's no worse than that. Remember, when you call 113, you are not alone. The fact that you can and are willing to help makes the difference. Now that you have learned the basics of CPR, all you need to remember is,
Annie, can you hear me?
if you cannot wake the person up, call 113 and we will handle it from there. Have you got it now? In part 1 of this series on first aid,
3, 4,
you have learned
5,
that chest
6,
compressions alone are a good treatment for sudden cardiac arrest. Now we will reinforce what you have learned. You will practice in pairs. Your course leader will now take over.